Today, I am pleased to welcome to the show Dr. David Rosensweet. Dr. David Rosensweet graduated from the University of Michigan Medical School in 1968. Since 1971, he has been in private medical practice with offices in Florida, New Mexico, which is where I live, California, and Colorado. Earlier in his career, Dr. Rosensweet trained the first nurse practitioners in the United States and was in charge of health promotion for the state of New Mexico. He is a nationally known lecturer, presenter at the American Academy of Anti-Aging Medicine, the American College for Advancement in Medicine, the Age Management Medicine Group, and more. In 2019, he was called to Washington to speak in front of the National Academies of Science, Engineering, and Medicine on the safety and efficacy of bioidentical hormones. Dr. Rosensweet is the founder of the Menopause Method and the Institute of Bioidentical Medicine, where he has been training medical professionals to master EBHRT using the most advanced and modern tools. His protocol has been used to treat over 12,000 women. Dr. Rosensweet, welcome to the show.
Thank you, Carol Covino.
I am so curious. I want to back up a little bit and know something about your story. What brought you into the field of hormones and bioidentical hormones?
Well, I had my first practice in 1971 in Santa Fe. And right out of the gate, I was exploring nutrition and toxicity and ultimately what became functional medicine. And in 1993, in a different office in Santa Fe, one of my patients in her mid-40s came in early in the morning, walked right into my consultation room while I was doing paperwork, pounded her fist on my desk, and said, "I'm going crazy, and I don't want you to pretend that you know me. I am really in trouble here." And I knew her really well. She was so successful that she had retired in her mid-40s, so I knew something was up. And I had serendipitously spoken to an expert medical doctor who brought progesterone into the world, gave her some progesterone, and 3 weeks later, I got a letter from her saying that, "Oh my God, this stuff is amazing. I feel myself again." That was very impressive. It was very unusual by the time someone makes an appointment with a medical doctor to have such that it's usually a slow moving train to help them get well. And this was very dramatic and overnight. Well, I never really planned my career. Before I knew it, I was seeing a lot of women in menopause, and I found it very rewarding, and I decided to specialize in it to get really good at it. And that's when it all began, 1993, for me.
That's shortly after we moved from San Diego to Albuquerque, and we lived in Santa Fe for a bit in 91, 92. So very interesting how you got into that. You know, my own journey through menopause, I'm 62 now, and my own journey over 12 years ago when it all started was such a rocky path because nobody was really talking about. Now people are having the discussions. Nobody was having the discussions. So I took a while to reach out for help. And one of the things that held me back was fear because of all the rhetoric around, okay, hormones are not safe, you can get breast cancer. Can you speak into this a little bit?
That's a very important question to address. Women have been and men have been treated with hormones for 1,000 years. The Chinese figured out how to collect urine from young, healthy women and put it in a big vat and dry it out and feed it to the air, feed the powder that was left behind to the aristocracy. And same for young men. And then in the 40s, the pharmaceutical manufacturers, a little bit of a diversion here, giving a little history. I can cut right to the chase, but I'll get there quickly. The pharmaceutical industry learned how to extract hormones from the urine of pregnant mares, and by 2002, there was 18 million women in America on Premarin and Prempro, horse urine-derived estrogens. 40% of all women in menopause. And then out comes this study that was falsely reported in 2002. It was called the Women's Health Initiative. And it falsely reported an increased incidence in breast cancer, heart attack, and stroke. When you read the study, you see that there was a reduced incidence for women on Premarin alone, 21% reduction in breast cancer rates for women on Premarin alone. And for Prempro, there was a statistically insignificant increase in breast cancer, which in medicine means don't draw any conclusions. But the press got a hold of it, it blasted it out with the headline that women are at increased risk for breast cancer, and it was false. The study committee eventually retracted that study. That was published too, but hardly anyone's heard of the retraction. I was in Santa Fe at the time practicing, and I saw that when I read the study that it was falsely reported, and there was a lot of literature on the safety of hormones, so I just continued forward. I would like to pause and give you what the science is, because there is science behind this. Thank you. We're all at risk for thousands of diagnoses. We're all at risk for hundreds of cancers, every one of us. As a male, I'm at an increased relative risk for prostate cancer. That wasn't always so, but it is these days. Women are at an increased relative risk for breast cancer. That wasn't always so, but it's true this day. But given that we're all at risk and increased risk, women who are treated with hormones, and this is the science, this is the actual science, women who are treated with hormones are at less risk for breast cancer, heart attack, and stroke than women who are not treated with hormones. Women who have had breast cancer and have had that breast cancer properly treated happen to be at an increased relative risk for recurrence than a woman does for developing breast cancer new. However, women who have had breast cancer have had that breast cancer properly treated. Here's the science. They're at less risk for recurrence if they are treated with hormones than if they are not. And that's totally irrespective of a receptor site. So the science is hormones reduce your risk for breast cancer, heart attack, and stroke. And there's been an amazing book written about this by an oncologist, a cancer specialist, who has specialized in breast cancer. His name is Avram Blooming, and along with his writing partner, Carol Tavris, the book's called Estrogen Matters for those who really want to dive into the science and really see where I drew these conclusions from. And meanwhile, the original study, like I said, was retracted anyway. They admitted in 2018 in a published study, same committee, same authors, that after 18 years of follow-up, there was no increased risk in breast cancer, heart attack, and stroke. Again, hardly anyone's heard of it. Thanks for giving me the opportunity to.
Oh, thank you for clarifying.
Yeah.
Clarifying, because I get a lot of questions, but I tell ladies, you know what, I'm not a medical doctor. I can only give you my personal experience using bioidentical hormones, my own journey. So it's so good to have a medical doctor on the program who understands the science and can break it down and get rid of some of these fears, because I feel like there's still a lot of women not receiving the treatment or therapy that they need that could be so protective.
And that's a big deal. Getting scared away has been a misogynistic event of the highest order. Because, like, as a physician, I can see how powerful these hormones are, and I've treated people at all ages, including women and men in our 80s, 90s. And in the United States, there's an epidemic of assisted living facilities and nursing homes. And about 80% of the women in those nursing homes are there because of loss of muscle. leading to instability, canes, walkers, wheelchairs. That's the defining moment where many of them need to go into the nursing homes. Also, loss of bladder control and loss of cognition. The experts that I speak to, we think that about 99% of this could be avoided merely by instituting hormone treatment whenever someone came around to it. Almost, it's almost that successful. So it's such a big deal because I can tell you from experience as a physician and as a son that that moment where you can no longer take care of a parent at home, lost bladder control, not able to walk, is a really rough moment for a parent. They want to stay at home.
Right.
And they're strong and they'll go into a nursing home. They'll do what they need to do, but they'd much rather stay walking and talking at home. And almost everyone would be able to do that if they did hormone replenishment. And I'm not just talking about women, I'm talking about men. We treat men too. Men lose the muscle too, wind up in nursing homes for what a gerontologist, aging doctor specialist, taught us in 1968, that old people, the bane of the elderly is loss of muscle. They fall, they break a hip, they die. And it's also loss of cognition. And so much of it could be prevented by good hormone replenishing.
Boy, I'm in agreement with you. My life completely turned around when I went on hormone replacement therapy. And thankfully, I got in that window, which brings me to a question. Is it ever too late? So let's say there's a woman listening right now and she's already gone through menopause, maybe post 5 years. Is it too late for her to do therapy?
No, that's the short answer. I didn't start treating my mother and my mother-in-law until they were in their mid-80s. My mother wouldn't let me be her doctor, especially around hormones, until her late 80s. And you never say never. And there was gain there in both my mother and mother-in-law from the treatment. But it's a lot easier to, if you can do it before your 80s, 70s, 60s, 50s, 40s, perimenopause, it's a lot easier thing. But we say at any age. Now, there are some caveats. When a woman has been without hormones for, well, the number that's used is 10 years, she's been without the protection of her coronary arteries from estrogen. Thus, she's more vulnerable to coronary arterial sclerosis and a clot forming. And there's 1 year of window, this is pretty technical, that when you administer estrogen to someone who has a clot in their coronary artery, they're more at risk for that clot breaking loose and thus a heart attack. This is not an issue for us medically. So when we encounter a woman who's been 10 years without her hormones, we do special evaluations to make sure she's not in that vulnerable position of having a clot in her coronary arteries. And it's an echo stress test. It's not that complicated. Or we sometimes have to do coagulation profiles under special instances. Now, we will do it earlier. We will do that assessment earlier. If a woman's mom had a stroke and her aunt had a heart attack, 10 years is not a magic number for us. We pay attention to the patient and assess earlier. Now, having said that, just think about what that implies for the importance of estrogen. Women get special protection of their coronary arteries, all arteries, from atherosclerosis from estrogen. So do men, by the way. And so since half of women pass away from complications of arteriosclerosis, that protection is really critical, which speaks to as early as you can figure it out, as early as you can receive good treatment, do it early if you can. But again, there is no age limit. We just are more careful with implementing it, deploying it with the elderly.
Oh, thank you for clearing that up because I know that's a question because you hear some doctors say, oh, okay, there's, I think, like a 5 year window, and then the receptors aren't going to receive the
Not true.
hormones.
They Takes them a little while longer to wake up. Yes, they do go dormant. The comment about receptor sites is, but they're biologic, they're physiologic. They'll respond to the hormones. And to give you the flip side of that, I've treated many women who've been 10 years, 15 years out, no hormones, at their wits' end with what's happened to them. We begin treatment, go a little slower, it takes a little longer. There's benefit there of all kinds. So I've seen all kinds of things reverse.
Mm. I was so happy that I found somebody good here in Albuquerque, New Mexico, that she had the background in hormones. She knew how to do the testing. And I just really felt I got lucky with that because I was fearful, so I wouldn't pursue it. And then you go to your OBGYN and he wasn't really encouraging it at the time because of all the fears surrounding it. So it just made a profound difference in my life, in my mood, my cognition, uh, just everything, skin, hair, everything. Now, we think about estrogen as being, number one for women, but how important is testosterone for women?
Can I pause for just a moment and make a different comment, and then I'll go to that?
Absolutely.
One of my favorite experts in the whole field of hormones, a profound researcher. Her name is Dr. Devaki Berkson. She's in her mid-70s. And she points out that if you want to know what hormones do for you, take a look at the people who are on them. And Carol Covino, you look great. You do not look like. So if you want to look like Carol or me, I'm on hormones too. I'm 81.
Oh my goodness, you're
I'm on
kidding.
hormones too. So just, Dr. Berkson lectures all over the country very frequently, and people come up to her and they say, how did you get so vibrant? And she says, these are the most powerful biochemicals that exist in our bodies. We do great when we have them, and we don't do so good when we don't have them for a lot of reasons. Back to your question. How important is testosterone? Boy, you are asking the big ones. There's more testosterone in a young woman than there is her most potent estrogens. It speaks to how important the human body, the human female body, thinks of testosterone. And of course, estrogen's wonderful, progesterone's wonderful, but testosterone is very prominent. And testosterone is absolutely needed. I've made assessments over the years that, I think one of the most important things that we do for women is treat them with testosterone because they need it to preserve their muscles. And it's the loss of muscles that the gerontologist warned us senior medical students about. Sarcopenia, that's what puts people into nursing homes. And yes, exercise really matters, but most people will not retain enough muscle to walk without a cane or a wheelchair if they do not get replenishment of testosterone. And sarcopenia, muscle loss of the muscle that holds up the bladder in women, when you get that muscle, when that starts to disappear, you start getting into one of the major causes of loss of urine. So thus adult diapers. And then there's mood issues. These hormones are universal, and there's having a natural sense of I love life. I'm really interested in it. Not to mention libido. Testosterone, like all these hormones, they have a profile of wonder that without them, all that goes away. Testosterone is extremely important, and I can guarantee you that 99% of all women by 3 years into menopause will have testosterone so low they'll never be able to preserve their muscles. And these days, it seems to me, and I'm making a guess at this, that about 75% of women in the perimenopause have already had so much testosterone decline from stress that they're starting to lose muscle. And so if you're in the perimenopause, check your triceps. See if there's flab there where there used to be muscle. Or get down on the floor and see if you can spring up into a standing position like you could when you were a teenager or in your 20s. If you're getting off that floor slowly, or you're squatting, or you can't squat anymore, you've lost muscle. And that's a big deal. So yeah, thank you for the question. Testosterone is so important, as important as all these hormones are.
I agree with you. I know when I finally saw my nurse practitioner, mine was completely flatlined. I had no testosterone left, all the hormones gone. Now, what about delivery of the testosterone? Because there's so much controversy around this. Injections, creams, pellets. What do you think about all of these different methods?
Well, hormonal treatment of men and women in midlife and on is a very unusual situation going on. There's so much confusion, and there's so much lack of knowledge and experience that you get all these opinions, and you think, why is this so confusing? When you talk to an orthopedic surgeon about how to repair a fractured femur, you could talk to 10,000 of them on the planet Earth, and they're going to be pretty much in agreement. You do this is what you do, this is the best medicine. None of them, they don't have controversy about how to repair a fractured femur. Or a urologist. The body of knowledge in these specialties, urology, neurology, internal medicine, it's solid, it's golden, because they took the time to specialize and focus in on something, and you get really good at it. Well, that did not happen, and has not happened, in menopausal and andropausal medicine. About the time that medicine was breaking out into specialties all over the place, out comes the Women's Health Initiative, scares everybody, and physicians and nurse practitioners. It just never developed into a specialty. Although our team, our group, that's one of the things we're working on, is getting board certification, and we highly encourage specialization. So what happens when you go out to ask around what's the best thing to do? You get 50 different opinions, and most of them are lame, because there's very, very few physicians and nurse practitioners who have specialized in doing this work. Once you specialize and you pay attention to women, for example, you start seeing that this isn't about a method or confusion. It's about figuring out how to treat a woman properly, and you don't wind up with pellets. There's issues with pellets, big issues. So the FDA's really putting pressure on our profession to stop doing pellets, and there's good reason to do that. Now, sometimes there is success with pellets, with highly skilled pellet people, but I do not say pellets. I want to cut to what my best shot is. Estrogen, it's very important to apply it to the skin. You can take estrogen orally. I mean, think of birth control pills and think of oral Premarin and Prempro. It definitely works, but you got to use more dosage, and it's got to take a first pass through the liver. And what that does is it increases the risk for blood clots, because that's what it does, and it increases the risk for inflammation. But when you take it topically, it doesn't do that at all. So estrogen's beautiful on the skin. Same with testosterone. Testosterone is beautiful on the skin, and when you take it orally, you're going to use higher doses, and you put your liver at risk for significant trouble. It's hard even to find oral testosterone, and rightfully so. Now, you can inject it. My experience with human beings is we just love injecting every day. And if you're not injecting, we love cold steel piercing our flesh. It's just big fun. And, it works for men. I mean, mainly it's in the world of men where you're getting testosterone injections twice a week, but that's not physiologic. The testicles put out testosterone every day, and it's not physiologic to get a big injection dump. So testosterone topically to the skin is very best. It comes in creams and gels. And then years ago, when I opened up a jar of bias that was misshipped from my office from my Albuquerque compounding pharmacist, who's still around, I'm sure. I saw him recently. he used to ship directly to my patients, but a shipment mistake was made, and he shipped one of my patients' prescriptions to my office. And there it was, a white cosmetic jar. And I was so curious. I had never seen a hormone. I had been treating for 10 years, and I cracked it open, and out comes this strong odor because steroid hormones are not soluble in water. They're very poorly soluble, and you have to use strong solvents. So being a holistic doc, this really mattered to us. We spent years and quite a bit of time, energy, and money to develop an organic oils delivery system that you apply to your skin. So that's how we do it. That's how I take my testosterone. Women, they get 3 different bottles: progesterone, testosterone, and estrogen. So that's my favorite by far, organic oils. And I describe all this in my book, Happy Healthy Hormones, and your audience is welcome to download a free PDF copy of that from your website if you want. Karina has the link, and they can just click on it and get a free PDF copy of our book.
Absolutely. That would be wonderful. Thank you. Thank you, Dr. Rosensweet. I don't want to neglect to ask you about the men because you touched on that earlier. At what point are you seeing men younger and younger that are low on testosterone?
We sure are. It's really surprising. Men and women, our hormone levels peak at the age of 20, and then they gradually decline, men and women. Women have a big drop midlife, but men can drop way low early or take longer. But men and women both have the drop. And it is really surprising to see how many, it seems like so many more young men are getting low testosterone levels. We knew this was happening. There was a scientist who did a study in Florida of the Florida alligators in a certain lake. And what he found is that there was a gender changing going on, and there was a way reduced sperm count. And what he found was there was toxicity in that lake that was interfering with the receptor sites. They're called xenoestrogens. They interfered with the receptor sites, and they really affected the male alligator population hugely. So, and this was in the 80s. So we know about this. There's books written about xenoestrogens. So we think that there's 2 things: a really challenging time in history to live. So the stress is way up. So we recruit our sex hormones to participate and energize us, and also the xenoestrogens, the toxicity, the herbicides and the pesticides that are universal in our food supply. Whatever the reasons are, those are the most likely reasons. We're seeing reduced testosterone levels in men. I'm treating men in their 40s already because their decline is so great that they're having erectile dysfunction. We learned about men having erectile dysfunction. It was sort of not known, but when the medicine Viagra came out, which is one way to get erection to return in some men, it's really due to low testosterone. That's the major cause. But when Viagra hit the market, there was an explosion, massive production and purchase of Viagra, telling us that men were out there having trouble when we didn't know it. It was so massive.
Wow, I remember that when that was released, and I know exactly what you're talking about. Now for men, okay, we know it's important for their sex drive, their muscle. What else does testosterone do? Is it associated with energy levels?
Yeah. Once again, it's amongst the most powerful biochemicals in our body, and it really affects energy levels, mood. Where it gets men usually first is, and they don't care so much when they lose their morning erection. A healthy young man with adequate testosterone wakes up in the morning with an erection, and then that goes, and that can go unnoticed actually. But when they start having erectile difficulties, their testosterone is dropped. So yes, mood, muscle strength, drive, natural male aggression, not unnatural, not dysfunctional male aggression, but natural male drive for excellence, really. These all diminish, even the drive to go to the gym and work out. And I hear this from men frequently. I hear, God, I just have to pick myself up and drag myself to the gym when I used to go. And when I went, I would build more muscle. And now I can't even build more muscle, even though I'm working out twice as hard. So, yeah, but I'd go for the sexual dysfunction as the major reason that men really feel it.
Well, yes, it affects quality of life.
Oh,
I
yeah.
know that's the point I got to where wanting my quality of life back was more important than my fears, if that makes sense. When I finally went, you know what? I don't even care if there's a risk. I'm going in because I need to feel like myself again. And that's something I hear a lot from people. I just don't feel like myself. Do you hear that a lot?
Well, that was the very first thing I heard from Deborah in 1993. I am
Hmm.
not myself at all. And the flip side of that, Carol, is we know that we're really the work is really getting good when a woman says, "Oh my God, I'm myself again." So
Yes,
that's the mantra I teach physicians. I said, wait till you hear a woman say that, then you know you're getting in the zone.
exactly. Now, with lifestyle, because you touched on nutrition just a little bit earlier, and of course, on the strength aspect, getting to the gym, this question I get all the time from women. They'll say, should I fix my hormones first, or should I do my lifestyle? What do I do first?
They're both imperative.
Hmm.
As early as you can figure out that what you eat and how you exercise and how you respond to stress and reducing your toxic exposure, the earlier you can figure out that that really matters, take those on and make the changes over a year or two or three so you get real good at all of those three major topics, the better. And hormones too, right along with it. It's all of those things matter greatly.
Yes, they all work in conjunction. That's usually my answer. And I was fortunate enough, I had actually gotten a lot of my lifestyle in order before I got on to HRT, bioidentical HRT, and then everything seemed to go very fast. But I think it was because I had, I had my nutrition dialed in. I was strength training, and so my body responded really, really quickly. And that brings me to another question. How long does it take for either a man or a woman to respond to bioidentical hormone replacement therapy?
It depends on a couple of factors, like how long have they gone without.
Hmm.
But in general, a woman in her 40s or 50s who's in the perimenopause, she's still having periods, but they're irregular, or a woman in early menopause when it hasn't been, 6 months or a year without hormones, they can respond pretty quickly and get dialed in to the optimal zone within 2 to 3 months. I mean, that's what we're aiming for. And we want them, we know what those numbers are. We know how much a woman needs and what we know what too much is and we know what too little is. So to get in that optimal zone, it can take 2 to 3 months. If a woman has gone longer, it can take longer, 3 months, 5 months, 6 months. But once a woman gets on the path and she starts experiencing a little bit of goodness, it's no problem. They go, hallelujah, we're on our way,
Yes.
and so if it takes 6 months to a year, like sometimes vaginal dryness has gotten really not good, and sometimes it takes 3 to 9 months or even a year to get healthy restoration. But the initial changes where there's improvement, where you go from pain on intercourse to no pain for the women who are having intercourse, that's very inspiring. So it's no longer a matter of uh, no hope. It's a matter of, wow, this works. What if it takes me a year? So what?
Yeah, for me, I was feeling better in 3 months. And by six, I was like, okay, Carol is back. And I want to ask you as well, how long should a woman, and I have my ideas about this, but for the listeners, how long should a woman be on hormone replacement therapy? Is there a point where she's 80 and she goes off, or 75?
I bet your ideas are identical. So I'm going to tell you what my idea is, but I know I know we have the same. We haven't spoken about this, folks. I'll tell you, the only time I'd ever stop taking testosterone in my life is if I couldn't get the cap off and no one was there to help me. That whole statement that, well, you better take the lowest dose for the shortest periods of time was totally made up. There was no scientific basis to that, because everyone got so fear of hormones. So many women dropped them. There was 18 million and went down to 1 or 2 million.
Wow.
But the ones who dropped it, it was so problematic. Their lives were disrupted in so many ways that the doctors realized, some doctors, more forward-thinking doctors, realized we've got to give them some help and risk benefit. I mean, this is what we're talking about. Well, maybe you should take the lowest dose for the shortest period of time. And that's where that came from. But there was no scientific study on that at all. Now that's being reversed, even by traditional physicians treating women in menopause. And what I look at that. I have no control over that. So what I say to a woman is, you'll know, and the best science is take it every single day of your life that you're on Earth. Don't ever stop. And we see women year after year after year. There's women I've been treating for 20, 30 years. They wouldn't dream of stopping.
I agree.
They love it.
I agree. I have no intention of stopping. And I was told the same thing, not by my nurse practitioner, but I had gone into my regular medical doctor to get some referrals early on. And he had said, oh, the lowest dose, same thing you just said. And I'm glad that you're in agreement with me, because there's so many women, the bone density, that's something else we hadn't touched on, the importance for the protection over bone. You had mentioned the mental aspect, so many benefits.
Those are perfect examples, because a woman can be on hormones for 20 years and her bones are doing really well. She stops those hormones, she'll go into rapid bone loss decline, even if she stops in her 80s. We need these hormones for our bones. That's a perfect example of why you wouldn't want to stop, because you don't want to lose bone. It's not a good thing.
No, that is absolutely, the idea of it is terrifying to me. I don't think enough emphasis is put on that. It's kind of being foo-fooed. Women aren't really thinking about it. But boy, that bone loss, you don't want to be sneezing and breaking your spine, breaking bones.
I repeat what a gerontologist taught our senior medical school class in 1968. The bane of elderly is loss of muscle and bone. People can't walk with stability. They fall, they fracture their hip, and they die. Now, operations these days will keep them alive, but not much longer than a year after that first hip fracture. So, and I've seen fractures in the elderly, and you just don't want that. It's very painful, very tough recuperation if you get everything back from fracturing an arm or a pelvis or a leg or a femur or a hip.
Yeah, they often lose all mobility, can lead to death, as you mentioned. It's devastating to
But
break
the
a hip.
remedy is take hormones. You'll preserve those bones. Even women who have had bone loss, I have evidence in my patient population of the hormones restoring the bone. Well, you can see they went on hormone treatment and the osteoporosis turned to osteopenia, which is a much lesser degree. That means there's been improvement in the bones.
That's amazing. So they actually take it back and improve, even when you think, because we're often told there's a point of no return.
That's not what I find. And I had a case, this woman in her late 70s, that I've been following her for years, and we finally saw the bone turn around.
Wow.
to where she started building bone over the last couple of years.
That
Her
must
bone
be
density increased.
so gratifying for you, I'm sure,
Yeah, it
when you
is.
see this. Yeah,
Yeah,
you're doing
fun.
very important work. Well, Dr. Rosensweet, I want to be respectful of your time. I could just keep asking so many questions. This is a subject that interests me and I feel is critical for both men and women to hear. So I appreciate the work you're doing and you being on the show today. And as we begin to wrap up, first of all, was there anything I didn't ask that you would want the listeners to know? And how can they reach you? And of course, we'll have links to the free gift, the book.
Well, but it's a big subject, especially when you want to get it excellent, and everyone wants excellent treatment. So there's more questions, but you're very, very good at what you do. You hit the big ones,
Thank you.
most important ones. So there's nothing that comes to me, and if people want to reach us, there's a couple websites. For women, and men, it's bright.live, BRITE.live. And for healthcare professionals that want expert training in this so that they can become experts, it's IOBIM.org, Institute of Bioidentical Medicine.org. And then if you get a free copy of the PDF of my book, our contact information is in there as well.
Perfect. Thank you so much, Dr. Rosensweet. I really appreciate you coming on the show today. I know that the listeners are going to receive so much value.
Thank you, Carol. You're really great at what you do.
Thank
It's a
you.
blessing to
Thank you.
get this information out there.
Thank you. Thank you. And to our listeners, wherever you are in the world, we wish you every blessing. Bye for now.